Bismillahirrahmanirrahim. I'm going to discuss OSB of the lower limb. You will see some diagrams at first about muscles, then nerves, arteries, and bones of the lower limb. Any diagram, you must imagine, is this diagram showing anterior view, posterior view, lateral view, or medial view? To imagine this diagram, this is anterior view of the front of the thigh after removal of skin and fascia. The key muscle in this diagram is number 4, which extends from anterior superior iliac spine to the medial surface of the tibia, which is called sartorius muscle. This muscle is quadriceps muscle. Number 1, rectus femoris. Number 6, vastus lateralis. Number 7, vastus medialis. And if you remove number 1, there is a deep head which is called vastus intermedius. The forehead of the quadriceps inserted into this tendon called quadriceps tendon, then go to the patella. From the patella extend ligamentum patelli number 8, which extend to the tibial tuberosity. Number 2 is a ligament extend from anterior superior iliac spine to the pubic tubercle called inguinal ligament. This muscle from lateral to medial, iliacus, psoas major, pectineus. This muscle is called adductor longus, and the most medial muscle is called gracilis muscle number 3. This muscle, number 5, inserted into this white tract. This white tract extend laterally is called iliotibial tract. So number 5, muscle inserted into iliotibial tract is called tensor fasciae lata. You must memorize the nerve supply and action of these muscles. The next diagram showing the posterior view of the thigh. This region is called gluteal region, and this muscle present in the back of the thigh. At first, where is medial and where is lateral? This is lateral because this white tract is called iliotibial tract, which present laterally. Number 1 is called iliac crest. Number 2 is called gluteus maximus, inserted into the iliotibial tract, supplied by inferior gluteal nerve. Number 3, 8, and 7 are muscles of the back of the thigh. Number 3 go laterally. This is called biceps femoris. Number 7 is semitendinosus, and number 8 is semimembranosus. Semitendinosus is superficial to the semimembranosus. Number 7 and 8 go medially, so number 7 is semitendinosus and number 8 is semimembranosus. Number 9 is part of the adductor magnus. Try to remember that the medial compartment of the thigh arranged from anterior to posterior adductor longus, behind the longus adductor brevis, behind the brevis adductor magnus. So if you see posterior view, you will find at first adductor magnus, in front of the magnus brevis, in front of the brevis adductor longus. And the most medial muscle is called gracilis muscle. And this region is called popliteal fossa, contain number 6 popliteal artery, and this vein, popliteal vein, and 2 nerves. The medial one is called tibial nerve, and the lateral one, number 4, is called common peroneal nerve. This muscle is called gastrocnemius, contain lateral head of gastrocnemius and medial head of gastrocnemius. This diagram showing anterior view of the femoral triangle. This ligament is called inguinal ligament. This artery number 3 is called femoral artery, and this vein is called femoral vein. What about this vein that drain into the femoral vein? This is called great saphenous vein. And this large nerve is called femoral nerve. This muscle is called sartorius muscle. This is rectus femoris, vastus medialis, vastus lateralis, and this muscle is called tensor fasciae lata. The most medial muscle is called gracilis muscle. This diagram showing lateral view of the thigh. This white tract, number 5, is called iliotibial tract. Extend from the iliac tubercle to the lateral condyle of the tibia. Inserted into it two muscles. Number 8 gluteus maximus and number 9 is tensor fasciae lata. These two heads, number 6 and number 7, a muscle of the posterior view which go laterally inserted into the styloid process of the fibula. These two heads belongs to the biceps femoris. This is long head of biceps number 7 and this is short head of biceps number 6. This diagram showing anterior view of the thigh after removal of the sartorius muscle. Here is the cut edge of the sartorius. So these muscles are quadriceps rectus femoris, vastus medialis, vastus lateralis, and if you remove the rectus femoris you will find vastus intermedius. The forehead inserted into quadriceps tendon number 5, inserted into the patella, extend from the patella ligamentum patelli to the tibial tuberosity. This ligament is called inguinal ligament. This vein number 3 is called femoral vein and this artery number 1 is called femoral artery. From the femoral artery a large branch number 7 which is called profunda femoris. This nerve is called femoral nerve. From the femoral nerve a long nerve arises which is number 4 which is called saphenous nerve. So number 1 is femoral artery. Number 2, this muscle is called pectineus. This muscle is called adductor longus. This muscle is called gracilis muscle. The next diagram is anterior view after removal of sartorius, removal of the rectus femoris, and removal of the adductor longus muscle. This muscle is sartorius. This muscle which is cut in is called rectus femoris. After removal of the rectus femoris you will find number 7 vastus intermedius. This muscle is vastus medialis and this muscle is vastus lateralis. What about the medial group? If you see here this muscle is removed which is the adductor longus. If we remove the adductor longus I will find number 3. This muscle is called adductor brevis muscle. What about this artery? Number 1 is external iliac artery. External iliac artery pass deep to the inguinal ligament to become femoral artery. The femoral artery give a large branch which is number 4 which is called profunda femoris. Profunda femoris give many branches like perforating branches. And this artery that go laterally is called lateral circumflex femoral artery. It gives ascending branch, transverse branch, and number 8 is a descending branch of lateral circumflex femoral artery. Number 3 is adductor brevis. Related to the adductor brevis, this nerve. Number 2 and this nerve, which is obturator nerve. The obturator nerve has anterior branch number 2 and posterior branch. Number 5 is gracilis muscle and number 6 is part of the adductor magnus which is ischial part of the adductor magnus muscle. This diagram is posterior view. This is gluteal region and these muscle present in the back of the thigh. At magnification number 1 is called gluteus minimus. This muscle is called gluteus medius and this large muscle is called gluteus maximus muscle. Number 2 is piriformis. This muscle is superior gemellus. Number 3 obturator internus and this muscle is called inferior gemellus. A quadrangular muscle number 4 is called quadratus femoris muscle. This ligament is called sacrotuberous ligament. This muscle is called piriformis. Above the piriformis, this nerve is called superior gluteal nerve. Supply gluteus minimus, gluteus medius, and tensor fasciae lata. Below the piriformis, this nerve is called inferior gluteal nerve, which is supply the gluteus maximus muscle. The largest nerve is sciatic nerve. The largest nerve is the sciatic nerve, which is number 5. This nerve go again to the perineum. Number 7 is called pudendal nerve. This nerve is nerve to obturator internus. This nerve go to quadratus femoris, nerve to quadratus femoris, and lastly this nerve is posterior cutaneous nerve of the thigh. This diagram showing also the back of the thigh. The muscle that arise from the ischial tuberosity and go laterally is the biceps femoris. Has long head of biceps and short head of biceps. This muscle is semimembranosus and the superficial muscle is semitendinosus. This large nerve is called sciatic nerve, divides into number 5 tibial nerve and common peroneal nerve. This artery in the popliteal fossa, popliteal artery, this vein is popliteal vein. Number 6, a small vein drain into popliteal vein called small saphenous vein or short saphenous vein. The next diagram showing the compartments of the leg. This is anterior view to see the anterior compartment and part of the lateral compartment. And this diagram showing posterior view of the leg. Number 1, this vein is popliteal vein. This artery is popliteal artery. Number 2, this nerve is called tibial nerve and this nerve is called common peroneal nerve. The tibial nerve pass into the back of the leg and appear again here as number 5 is also tibial nerve in the leg. This muscle is cut, which is gastrocnemius muscle. This muscle number 7 is popliteus muscle and number 6 a slender tendon which is plantaris muscle. After removal of the gastrocnemius, this deep muscle number 3 is soleus muscle. Soleus muscle and gastrocnemius inserted into this tendon which is tendocalcaneus or tendoachilles. This is anterior view of the leg. Number 9 is ligamentum patelli. Number 10, you can follow this tendon which inserted into the first metatarsal bone which is tibialis anterior. Number 11, if you follow the tendon, this tendon inserted into the big toe, so it is called extensor hallucis longus. Number 14 divides into many tendons which go to the lateral foretoes, which is called extensor digitorum longus. And this small tendon is called peroneus tertius. On the dorsum of the foot, there is a muscle called extensor digitorum brevis. The medial tendon that go to the big toe called extensor hallucis brevis, which is number 12. Number 13 is superior extensor retinacula and this is called inferior extensor retinacula. Again, this view is anterior view about the anterior compartment of the leg and the dorsum of the foot. This tendon, number 1, go to the first metatarsal bone, so it's called tibialis anterior. This tendon go to the big toe, number 4, which is extensor hallucis longus. This tendon, which is removed, go to the lateral foretoes, is called extensor digitorum brevis. Is called extensor digitorum longus. This muscle in the dorsum of the foot called extensor digitorum brevis. This artery with this nerve, number 2, is called anterior tibial artery. Between the two malleoli, it continues as number 5, which is dorsalis pedis artery. The dorsalis pedis artery give many branches like number 8, which is called arcuate artery. What about the nerve? This nerve number 3 is called deep peroneal nerve. The same as this diagram, this is superior extensor retinaculum and this is called inferior extensor retinaculum. The medial tendon is called tibialis anterior, pass in front of the medial malleolus. The next tendon go to the big toe extensor hallucis longus, this tendon extensor digitorum longus, and the last tendon is peroneus tertius. The deep muscle, small muscle called extensor digitorum brevis. Its medial tendon that go to the big toe is called extensor hallucis brevis. The next diagram showing lateral view of the leg. The long muscle in the lateral view is called peroneus longus. A short muscle called peroneus brevis. They pass behind the lateral malleolus under the peroneal retinaculum. This muscle laterally is called biceps femoris and this tract is called iliotibial tract. These two retinacula are peroneal retinacula, superior and inferior peroneal retinaculum. This diagram showing the posterior compartment of the leg. At the first diagram, no muscles are removed, so this is medial head of gastrocnemius and this is lateral head of gastrocnemius. Inserted with the soleus in this tendon which is called tendocalcaneus. This artery, this is popliteal artery, popliteal vein, and this vein is a small saphenous vein. This nerve is tibial nerve medially and this nerve is common peroneal nerve. To see the soleus, you must remove the gastrocnemius, like this diagram. This muscle is gastrocnemius, which is removed. To see the deep muscle, which is soleus muscle. What about this tendon, slender tendon, is called plantaris muscle, and this muscle is called popliteus muscle. After removal of the soleus muscle in this diagram, you can see the last three muscles in the back of the leg. This tendon arise from the fibula and go to the big toe is called flexor hallucis longus. This tendon arise from the tibia called flexor digitorum longus, and from the tibia and fibula this muscle is called tibialis posterior. Try to remember that this artery is popliteal artery. It divides into anterior tibial and this artery is posterior tibial artery. This nerve is tibial nerve, enter to the back of the leg and continue in the sole of the foot, divides into medial and lateral plantar under this retinaculum which is flexor retinaculum. In this diagram showing the sole of the foot, after removal of the skin and fascia, the deep fascia is thickened to form this aponeurosis, which is called the plantar aponeurosis. It protects the underlying vessels and maintains the longitudinal arch of the foot. After removal of the plantar aponeurosis, we will find in the first layer three muscles. This muscle that go to the big toe produce abduction, so it is called abductor hallucis. This muscle that go to the little toe to produce abduction called abductor digiti minimi. And in between this muscle which produce flexion, so it is called the flexor digitorum brevis. So in the first layer there are three muscles. From outside, abductor hallucis and abductor digiti minimi. And in between flexor digitorum brevis. After we cut the first layer muscles, we will find the second layer. If you see here, there many muscles are removed. To see two long tendons. This tendon is called flexor hallucis longus that go to the big toe. And this tendon is called flexor digitorum longus. And there are two other muscles like this muscle. It's called accessory flexor digitorum accessorius and these muscles are called lumbricals. First, second, third, and fourth lumbrical muscles. After we remove these long tendons, we will find the third layer. Here, in this diagram, the flexor hallucis longus is removed and also flexor digitorum longus is removed. So we find the three muscles. This muscle and this muscle flex the big toe and little toe. So it's called the flexor hallucis brevis and the flexor digiti minimi. This muscle produces adduction of the big toe, so it's called adductor hallucis. So in the third layer, there are three muscles: flexor hallucis brevis, adductor hallucis, and flexor digiti minimi. The fourth layer is formed of two tendons. The tendon that come laterally is called peroneus longus, and the tendon come medially is called tibialis posterior. So in the fourth layer, there are two tendons, which is peroneus longus and tibialis posterior. And there are dorsal and plantar interossei. These are plantar interossei, which produce adduction, and these are dorsal interossei, which produce abduction. So in the fourth layer, there are two tendons, tibialis posterior and peroneus longus, and two muscles, plantar interossei and dorsal interossei. Try to answer. Number one, flexor hallucis longus. This artery and nerve is medial plantar artery and medial plantar nerve. Number three is abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. After removal of these muscles, the second layer appear, which is two tendons, flexor hallucis longus and flexor digitorum longus, and these muscles. And this muscle is called flexor digitorum accessorius, and number 7 are lumbricals muscle. These arteries are medial plantar and lateral plantar artery. What about this muscle which is removed and go to the little toe? It's called abductor digiti minimi. It belongs to the first layer. Identify this nerve. This nerve of the medial compartment is obturator nerve. This is adductor brevis. The removed muscle is adductor longus, and this large muscle is adductor magnus. This muscle arises from outer surface of the obturator foramen is called obturator externus, and the most medial muscle is gracilis muscle. So this nerve is obturator nerve. This nerve, largest nerve of the body, is called sciatic nerve. It divides into tibial nerve, and this nerve is common peroneal nerve. What about number 1? This muscle of the back of the thigh go laterally, so it is biceps femoris. Number 5 is superficial, so it is semitendinosus, and number 4 is deep, so it is semimembranosus. Number 3 is medial head of gastrocnemius, and number 2 arise from tibial nerve, go superficially, so it is sural nerve. This diagram showing the popliteal fossa and its nerves. This is called tibial nerve that enter the back of the leg, and this is called common peroneal nerve. Who can identify this muscle? This muscle go laterally, so it is biceps femoris. These two muscles go medially. The superficial one is semitendinosus, this one is semitendinosus, and the deep one is semimembranosus. These muscles are gastrocnemius. The deep muscle is popliteus, and this small muscle is called the plantaris muscle. These muscles, lateral one, come from the fibula, so it is flexor hallucis longus. This is flexor digitorum longus, and in between tibialis posterior. This artery is femoral artery. What about the beginning of femoral artery? Continuation of the external iliac artery at the mid-inguinal point. It passed through the adductor opening to continue as popliteal artery behind the knee joint. Then the popliteal artery divides into anterior tibial and posterior tibial artery. From the femoral artery, a large branch arises called profunda femoris. Profunda femoris has many branches. These are perforating branches. The branch that surrounds the femur laterally is called lateral circumflex. It divides into ascending, transverse, and descending branch of lateral circumflex femoral artery. And this branch that go medially is called medial circumflex femoral artery. Now, try to identify the muscle producing this action. This action is flexion of the hip and extension of the knee. The muscle that produces this action is rectus femoris muscle. Also, at this diagram, here there is flexion of the hip and extension of the knee. So rectus femoris produce this action. What about the muscle produce this action? There is extension of the hip and extension of the knee. The muscle produce this action is gluteus maximus. What's the main muscle during walking upstairs? Gluteus maximus. What's the main muscle during standing up from sitting position? It is gluteus maximus. Identify this tendon. This is lateral view. The tendon appear here is the tendon of peroneus longus. Also, this tendon is for the peroneus longus muscle. Identify the nerves supply the sole and dorsum of the foot. This is sole of the foot, supplied medial 2/3 of the sole and medial 3.5 toes by medial plantar, lateral 1/3 and lateral 1.5 toes, including the nail beds, by lateral plantar nerve. The medial side supplied by saphenous and the lateral side supplied by sural nerve. The heel is supplied by calcanean branch of the tibial nerve. What about the dorsum of the foot? This area is supplied by saphenous nerve. This area, number A, is supplied by superficial peroneal nerve. This area, number E, is supplied by sural nerve. And this area between big and second toe is supplied by deep peroneal nerve. What about the dermatomes? Medial side of the leg supplied by L4, lateral side by L5. The medial side of the big toe by L5 and the little toe by S1. This diagram showing dilated tortuous vein. This is medial side of the leg, so this vein is great saphenous vein. The dilated tortuous vein is called varicose vein. Lastly, I'm going to discuss the bones of the lower limb. At first, you must imagine this diagram. At first, where is anterior and posterior in this diagram? This is anterior because this is pubis, ischium, and ilium. And this area articulated with the sacrum. Number 2 is called auricular surface. This is for sacroiliac joint, articulation between sacrum and ilium, which is synovial plane. And this rough area called iliac tuberosity for the sacroiliac ligament. Number 3 is ischial spine, attached to it sacrospinous ligament. Number 4 is called ischial tuberosity, and number 5 for attachment of sacrotuberous ligament. Number 6 is symphysis pubis, which is secondary cartilaginous, related to the epiphyseal cartilage. And number 7, area related to obturator artery, nerve, and vein, because this foramen is called obturator foramen. These spines, number 9 and 10, are called iliac spines. Number 10, anterior superior iliac spine and anterior inferior iliac spine. The muscle attached to the anterior superior is sartorius, and the ligament is inguinal ligament. Number 9, attached to it rectus femoris, and the ligament is iliofemoral ligament. This line that separates between false pelvis and the true pelvis is called iliopubic line or iliopectineal line. The tubercle in the pubis is called pubic tubercle, and this crest is called pubic crest. Number 11 is called iliac fossa for attachment of iliacus muscle. This is outer view of the hip bone because this area is called acetabulum for articulation with the femur. So this is called gluteal surface of the ilium for attachment of number 14 gluteus minimus, number 13 gluteus medius, and this area for gluteus maximus muscle. In this diagram, this is posterior and this is anterior. So number 2 is anterior superior iliac spine. Sartorius and inguinal ligament attached to it. Number 3 is anterior inferior iliac spine. Rectus femoris and iliofemoral ligament attached to it. Number 1 give attachment to tensor fascia lata. Number 5 is the acetabulum. This surface is called leonate surface. This joint is hip joint. The type of this joint is synovial ball and socket. Number 6 is pubic tubercle. Attached to it inguinal ligament. Number 7 give attachment to the adductor longus muscle. What about number 11? It's called greater sciatic notch. And number 10 ischial spine. This is called lesser sciatic notch, and all of this area is called ischial tuberosity. The ischial tuberosity give attachment to many muscle. This area is quadrangular area and this area is triangular. All of this is triangular and this area is quadrangular. In the triangular area, lateral part give attachment to the adductor magnus. And this triangle near the acetabulum, I mean upper lateral triangle, it give attachment to the semimembranosus. And this triangle give attachment to biceps and semitendinosus. About the femur, number 1 is shaft of the femur. Number 2, intertrochanteric line, give attachment to iliofemoral ligament. Number 3, lesser trochanter for attachment of iliopsoas, iliacus and psoas major. Number 6 is greater trochanter of the femur. Number 7 is intertrochanteric crest. This area is called quadrate area for the quadratus femoris. Number 9 is linea aspera. Divides superiorly into number 8 and number 13. Number 8 is gluteal tuberosity and number 13 is spiral line. Inferiorly, it divides into two supracondylar lines which enclose this area related to the popliteal fossa, so it is called popliteal surface of the femur. Number 10. Number 12, above the medial condyle, give origin to the medial head of gastrocnemius. Number 11 is adductor tubercle, and also number 4 is adductor tubercle. 14 is head of the femur related to the hip joint, type of the joint synovial ball and socket. Number 15 is fovea on the head of the femur for attachment of round ligament of the femur, or called ligament of the head of the femur. This is tibia and fibula. This tuberosity called tibial tuberosity. This is called neck of the fibula. This is called lateral malleolus and medial malleolus. This is called medial condyle of the tibia, lateral condyle of the tibia, and in between intercondylar eminence. About the surfaces of the tibia, this is called medial surface, this is called lateral surface, and this is called posterior surface of the tibia. This is medial malleolus. The muscle related anteriorly is tibialis anterior. The muscle related posteriorly to the medial malleolus is tibialis posterior muscle. This diagram showing the knee joint. This is posterior view and this is anterior view of a flexed knee. The femur is flexed, so this is the condyles of the femur. This is medial condyle and lateral condyle. If we remove the capsule of the knee joint, we will find this ligament, which is called cruciate ligament, anterior cruciate ligament and posterior cruciate ligament. Number 3 is menisci, medial meniscus and lateral meniscus. This ligament, number 6, is called lateral collateral ligament or fibular collateral ligament. Number 2 is called medial collateral ligament or tibial collateral ligament. Tibial collateral ligament is firmly attached to the medial meniscus, but lateral collateral ligament separated from the lateral meniscus by this tendon, which is popliteus tendon. Number 4, this area give attachment to SGS, sartorius, gracilis and semitendinosus. And this, number 5, lateral condyle of the tibia give attachment to iliotibial tract. This diagram showing the muscle attachment to the bones of the lower limb. This muscle, gluteus minimus, gluteus medius, and number 10, gluteus maximus. Greater sciatic foramen and lesser sciatic foramen. Muscle attached here, many muscle attached to the greater trochanter. Here is piriformis muscle. Number 3, this muscle attached to the linea aspera, which is adductor magnus, and also attached to the adductor tubercle. So number 3 is adductor magnus muscle. This muscle is gastrocnemius, lateral head and plantaris. What about number 7 and 8? Number 8, semimembranosus, and number 7, popliteus muscle. About the anterior view, this muscle is iliacus. This muscle, number 11, attached to the anterior superior iliac spine, is called sartorius. Anterior inferior iliac spine, rectus femoris. These two muscles are called vastus lateralis, vastus medialis, and this muscle vastus intermedius. This is patella, which is a sesamoid bone. This tract, number 15, iliotibial tract. Number 16, tibial tuberosity, attached to it ligamentum patelli, and here is SGS, sartorius, gracilis, and semitendinosus. Lastly, these are the bones of the leg and foot, anterior view and posterior view. In the anterior view, here is SGS, sartorius, gracilis, semitendinosus. Tibial tuberosity give attachment to ligamentum patelli. Lateral condyle of the tibia give attachment to iliotibial tract. Number 4, attached to the fibula, styloid process of the fibula is biceps femoris. Number 1, tibialis anterior. This muscle arises from the fibula. This muscle is extensor digitorum longus. And number 3, peroneus tertius. And this muscle from the middle half of the fibula, extensor hallucis longus. Posterior view, this is semimembranosus. Muscle here is popliteus muscle. Number 6 and 14 is soleus muscle. Number 7 arises from tibia and fibula, so tibialis posterior. From tibia give attachment to flexor digitorum longus, and from the fibula flexor hallucis longus. In the calcaneus, tendocalcaneus, and all of this insertion is for tibialis posterior muscle. Very special. Thank you.